Are you suffering with low back pain in 2024? You have read all the articles, you have watched all the YouTube videos, and you're trying to figure out where to start and what are the most impactful things for your low back pain? Well, that's what we're going to discuss today. There's been a ton of research that's come out on low back pain. We're going to sift through it all and come up with the strategies that are proven to work to help with low back pain that you can implement. The great thing is these strategies you can implement today at home. You don't need any special equipment or anything like that. You don't have to go see a doctor or consult a specialist, and you can start on your journey dealing with your low back pain today. Low back pain affects 80% of people at some point during their lifetime. And that's why I felt like it was so important to make this video to look at what the most common treatments are today, things that you can actually do at home to start working on your low back pain. Now, I understand yours may be excruciating. You may need to consult a specialist or a doctor to help with your particular low back pain. But I guarantee, even if you do need to do those things, these strategies, if you start implementing them now, will help you on your journey. I'm not saying that this is going to fix your low back pain, but this is what the research very, very clearly shows needs to be done in order to keep your low back pain from coming back. Now, many people are wondering what is actually causing their low back pain. And I'm going to link a video here that discusses more of the different tissues in your low back and what may be causing your low back pain. However, in general, your low back pain is probably caused by some form of tissue damage, be it ligament or a muscle or disc or nerve, or the joints are getting compressed. But that low back pain is coming from a tissue that's getting damaged in your low back. And in that other video, we discussed different things that you can do as well to help heal that. For today, we are going to focus on the top things that you can do right now to help your low back pain at home in 2024. These strategies are not just my opinion, it's what's been clearly shown in the research to have the long-term impact that you're looking for. First off, posture. It is very difficult in our world today to maintain a good posture at all times, whether we're sitting for prolonged periods of time, standing for prolonged periods of time, maybe having to stand on concrete, which puts a lot of stress and strain through the low back. It is very difficult to maintain a posture that's appropriate for long periods of time. That's why I want to make sure that if you are sitting for a long period of time or standing for a long period of time, you make gentle adjustments. So I usually recommend every 15 minutes making a gentle adjustment. So for instance, if you're standing, making sure that you start with a good posture. So that's head over shoulders, shoulders over hips, hips over feet when we're in standing. And then you can do some adjustments along the way. So you may kind of shift weight to the right for 15 minutes, shift weight to the left for 15 minutes, put weight through your heels for 15 minutes, put weight through your toes for 15 minutes. If you have to be in a standing position for a long period of time, making sure that you do these very subtle shifts can make a big difference in how your low back responds to that. Now, if you're sitting for a prolonged period of time, it's a little bit easier to do some of those adjustments because you can use pillows or towels to make sure that your body is in the correct position, but also gets a little bit of a shift. Again, we want to make sure that head is over shoulders, shoulders are over hips, and obviously your feet are just squarely on the ground about hip distance apart. But you can use pillows or towels that are rolled up or placed behind your back to give you a different posture throughout the day. It can be helpful also to get one of those big therapy balls to sit on. That way you can do a little bouncing, you can do some circles with your hips, and in general, keep your low back moving a little bit while you're sitting. The next thing we want to do is do some stretching for that low back in order to keep things moving correctly and to decrease stress. Now, stretching doesn't necessarily mean bending forward, although it might. Most people with low back pain either find relief with bending forward or find relief with bending backwards. Now, you got to try it out to see which one works best for you and be gentle when you do it. Make sure that you're only going forward a little bit at a time. See how your body feels with that. If forward doesn't work for you, chances are pretty good that backwards will work for you. Now, if you're bending backwards and you don't feel comfortable doing it in standing, which a lot of people don't, what I recommend is a Sphinx pose. So what you're going to do is you're going to lay on your stomach and then you're going to prop yourself up on your elbows, which gives you that gentle backward bend through your low back and also helps to decrease some stress on the tissues in the low back. Now, if neither one of those is feeling very great, but you do feel like you want to stretch, but you can't go forward and you can't go backward, then what I recommend is trying to get longer. So you're going to lay on your back, you're going to put your arms up over your head, assuming your shoulders are okay with that, and you're going to try to stretch out as far as you can. So pulling your feet away from your hands and your hands away from your feet. Just trying to get some decompression in that low back can be very relieving. Holding this position for about 5 seconds and then just let everything relax and lay there and see how everything feels. Now, for some people, this is even too aggravating because they don't like laying with their legs down flat. In this case, what you can do is put a pillow underneath your knees, which will help to relieve some of that tension on your low back. Now, you can potentially still stretch all the way out while you're actively stretching, but that way you have that pillow underneath there for when you relax. All right, friends, tip number 3, I will admit, is a little bit controversial because the research isn't really clear on if ice helps with low back pain or not. Specifically, the research is not clear on if it does anything to change the state of the tissue. Now, the state of the tissue is inflamed and angry, right? That's why you have the pain. However, what remains unclear is if ice actually helps to change the state of that tissue. And since the research is unclear, I am not going to say, yes, you have to ice or no, you don't have to ice. But what I can tell you is most commonly my patients who ice their low back for 3 to 5 minutes do get some relief for a period of time, whether it be 1, 4, 8 hours, which means you don't have to take pain medication. So if you don't want to take pain medication, use some ice, at least to help with that pain. It may help you be able to do some more stretching and more active motions, and that's what's going to heal your body. Now, what is coming out more and more in the research now is the mind-body connection. So this is the understanding that our bodies are connected to our brain. And in all honesty, our brain is where we perceive that pain or that issue that's happening in our body. So what we want to do is help to calm our brain down and say, hey, it's okay. I know you have pain and I know you're trying to protect me, but it's okay. I'm finding some strategies to help with this. The most effective way to start doing that is to do some deep breathing exercises. Not only does that help to decrease the tone in the diaphragm, which is the muscle that's responsible for breathing, it also helps to equalize the pressure in the abdominal cavity, which obviously is right near the low back. And the really big benefit is that it activates the vagus nerve. The vagus nerve is your chill out nerve, and it causes all those organs to just relax and decreases the organ mobility. So your vital organs like digestion, which is really important because if you get constipated, that's going to increase your low back pain. I know, friends, it's all connected, and it cannot be more important to do your breathing exercises than when you are suffering from low back pain. We want to tell the mind, it's okay, we've got this, we're working on it, and it's getting better. The other thing that is really coming out in the research right now is the impact of diet on low back pain, particularly anything that you might be eating that is causing increased inflammation in your body. Now, you may have heard of food allergies, or maybe your friends have talked about intolerances that they have that caused increased inflammation in them. You may or may not be suffering with those, and that may be something that's good to look into. At home, if you want to do it on your own, you can do an elimination diet. So if there's something that you feel like increases your inflammation, simply eliminate it for 1 to 4 weeks and see if you feel any better. Now, here's the thing. You can't eliminate more than one thing at a time, or else it's not very scientific. So if you feel like a whole bunch of things that you're eating are causing increased inflammation and you want to get rid of all of them at one time, then when you add them back in, only add in one at a time, once per week. That way you can see how your body is responding. I once had a patient who we worked together. We were able to eliminate her low back pain, and along the way she had given up gluten. Well, when she returned a year later because her low back pain was back, I asked her how she was doing with giving up gluten, because that is really challenging. And she said, oh, it's impossible to give up gluten, and I've started eating gluten again. Well, it made it more difficult to get rid of her low back pain the second time because she was still eating the gluten. I'm not saying it's impossible, but if you want to improve your odds of getting over this as quickly as possible, decreasing the amount of inflammatory foods that you're eating will go a long way. Now, one of my favorite things to recommend is exercise. I know you're thinking, but that actually hurts to do that. And if it does hurt to exercise, then please do not right now. This may not be the best one for you to add in right now. However, making sure you're getting some cardiovascular exercise, so you're getting that blood pumping, that could be walking, jogging, running, swimming, biking, all of those things, really does help to get the blood flow to the area to help heal that low back pain. So within your tolerance for the activity that does not increase your pain, I recommend doing as much cardiovascular exercise as you can. And the last tip, which we are learning more and more about the importance of in regards to low back pain, but also in regards to brain health overall, is sleep. We are chronically sleep deprived, and that affects our body's ability to heal, because it's when we're sleeping is when we're healing. So if you feel chronically fatigued and you feel like you're never getting enough sleep, I definitely recommend working on your sleep hygiene and getting more sleep every night. Now, how much is actually needed? The research is not super clear. It seems that, shockingly, everybody's a little bit different. I can't imagine. What I want to encourage you to do is to learn what your body needs in regards to sleep. Making sure that when you wake up, you feel rested, you feel ready for your day, and you don't feel like you get totally exhausted too early in the day. So on average, it does seem to be between 6 and 9 hours is what people need, but realizing that there's variability. Figure out what the ideal sleep pattern is for you and how long your body needs to heal every night. All right, friends, there it is. The top things to work on in 2024 regarding your low back pain. Now, if these tips do not resolve your pain, or if you're still having pain after a week, I highly recommend that you seek help from a specialist who can understand more specifically about what's going on with your low back pain, can identify the structure or the tissue that is causing your low back pain, and give you more specific ideas that are geared towards you. I understand that these are very, very general techniques, but they are ones that will work for everybody. So I would love to hear your comments below. Drop a comment. Which tip was your favorite? Which one have you implemented? Which one do you feel is the most helpful for you in your low back pain to encourage other people on their journey? And before we go, this very, very, very important tip. Please make sure that once you have figured out what works for you, that even after your low back pain goes away, you continue doing it. So many people I know and I work with stop doing the things that helped get them out of low back pain, and 6 to 12 months later, that low back pain comes back. I definitely encourage you to find your secret sauce of what's going to work best for you. And then I ask that you continue doing it even after the low back pain goes away.